Well, throughout the month of October, you've no doubt heard conversations about breast cancer awareness. And while you may think it won't impact you, think again. Dr. Stacy Chronister is an internal medicine specialist with OSU Medicine, and she joins us this morning with details that all women and men need to hear about. We talk about statistics 1 in 8.
1 in 8?
That's a lot.
That tells us that almost everybody knows someone who has had breast cancer if they haven't been affected themselves.
I just felt it was really important before we wrap up this month that we have this conversation, because as I've talked to patients as a breast cancer survivor myself, a lot of times we just dismiss it. I mean, even people like Katie Couric can come out and talk about it, but until it touches your life or someone in your immediate circle, you just disregard.
It's easy to do that with everything in life, right? And so I think that us having awareness about this, and that it is normal to get screened. It is a good idea to get screened because of the prevalence, that it's these awareness months that are great for that.
Let's talk about who is at risk.
Yes. So obviously females, but men are at risk as well. So if you have a history of breast cancer in your family, you are significantly more at risk. The older you live, the more likely you are to have breast cancer. So aging is part of that. But you know, there's a lot of things that we can't control, such as genetics.
Right.
We know that if you have a first-degree family member who has breast cancer, you are more likely to have it.
And what does that mean when you say first degree?
First degree, so a mother, sister, or any male relative in your family. Yes.
Okay, and now we can modify our risk, though. There are some things that we can do, and you put together a really concise list, so let's kind of review some of the things that we can do.
The things that we can fix are we can lose weight and we can exercise regularly. We know that exercise beyond the weight loss has a lot of health benefits to it to decrease actually all cancer risks. Stop smoking, reduce our alcohol consumption, and avoid unhealthy foods, especially high salt foods, fast foods. That is going to leave us more likely to have breast cancer.
Now, there are some things that obviously those are the elements that we got to keep in mind. The family risk factor we can't do anything about.
No.
But there's an awareness to that.
Absolutely.
Just having those conversations. Do you think over the years, I mean, when celebrities, when prominent individuals like Betty Ford diagnosed with breast cancer, it changed the dialogue, didn't it?
Absolutely, and honestly, it's like that with a lot of things. Until a famous person has it, we kind of don't really know about it. But unfortunately, sometimes having someone who has that celebrity behind it brings awareness to people's homes, because that's someone that you identify with. So really, I think us getting our conversations with our providers of when we need to start that screening.
And let's talk about those screenings, because at one time, and they vary. They've gone back and forth. American Cancer Society has said one thing. CDC doctors have told us another. Mammograms are important, so when should we start?
Yeah, and honestly, even one doctor to the next might not necessarily agree and have the same guidelines, so find someone you trust. We absolutely all agree that someone between the ages of 50 and 74 should be getting screened regularly.
Okay.
Now, a lot of times we are starting those screenings at age 40, and really that is based on risks and what is your family risk associated with that. If you have any family history of a first-degree relative, we know that we start the screening 10 years prior to the time that they were diagnosed.
And I can give you a perfect example of that. I was diagnosed at the age of 41, had this conversation with my daughter yesterday.
She started at 31.
Yeah, she'll be that next year, 31. So that's how you kind of know that. I also want to talk about self-breast exam, because for me, I found my lump and I realized it was something different and I needed to go get it checked out. But that can be a dicey situation.
You know, 20 years ago, we were telling women that they need to be checking every month. I still remember having a hanger in college saying, remember to check once a month. And you know, really, we've kind of moved away from that, because I think we made a lot of people anxious, and breasts change, and that's normal. But what I like to recommend is have a familiarity with your breast. So definitely give yourself a good exam, maybe after a mammogram, right after you see the physician, so that way you know what your normal breast tissue is like. Have an awareness, so if there is a change, you know right away.
I want to run through this list real quick, because some people, this may be happening in your life, and so I want you to be aware of it. It does not automatically mean you have breast cancer. It means you need to go talk to a provider.
Absolutely. You need to get evaluated if you are having any of the following findings. So if you are having any dimpling of the skin, any discharge from your nipple, a change in in your nipple appearance. If you feel a breast lump or you've had a change in your breast shape, you feel like it's not fitting in your bra quite right, and if you're having any pain in your breast, you need to be evaluated. The dimpling of the skin, we call it peau d'orange. It actually looks like the skin of an orange. It has that kind of dimpling appearance to it, so anytime you see that on a breast, it's absolutely abnormal.
The first person who you should call if you find any of that?
Well, if you have a physician, then call the physician right away. There are a lot of organizations, however, that will do mammograms for someone who needs it right away. Project Woman is a big one in town, and I think you can call the state 211 and get that information.
Perfect, excellent. I just want to make sure we've covered the bases
Absolutely.
today.
You can get a mammogram, stat, even if you don't have a provider.
Great.
Absolutely.
Thank you so much for coming in today. It's always a pleasure. We'll see you in November.